Welcome to Fight Cancer Global's informational video series. Our aim is to empower individuals with knowledge and resources to combat cancer. Today's video will explore the role of clinical surveillance and follow-up care for leukemia patients, and how often they should be monitored, offering valuable insights and actionable steps to aid you and your family in the fight against cancer. The primary goal of clinical surveillance in leukemia is early detection of any recurrence. This allows for prompt intervention and the best chance of successful treatment if the cancer returns. Secondly, clinical surveillance serves to monitor the patient's recovery from treatment, evaluating their physical and psychological well-being. This is crucial for managing any lingering side effects of treatment and for assessing the patient's general health. Thirdly, clinical surveillance helps in the early detection of secondary cancers, which could develop due to genetic damage caused by chemotherapy or radiation therapy. Moreover, surveillance enables healthcare professionals to monitor the patient's response to any ongoing treatments or medications, ensuring their effectiveness and altering dosage or treatment strategies if necessary. Further, routine lab tests form a key part of clinical surveillance. These tests, which often include complete blood counts and tests for organ function, provide vital information about the patient's health and recovery. As part of surveillance, healthcare professionals also keep an eye on any long-term side effects of treatment. Some treatments for leukemia can cause long-term or late-onset side effects, such as heart or lung problems, and early detection of these can lead to better management and outcomes. In addition, patient education forms a significant part of clinical surveillance and follow-up care. Doctors and nurses use follow-up appointments to educate patients about signs of recurrence, late side effects, and general health and wellness practices. Next, regular surveillance visits offer an opportunity to address patients' concerns and queries. Having an open dialogue with healthcare providers can significantly ease anxiety and improve quality of life for leukemia survivors. The frequency of follow-up visits varies based on the type and stage of leukemia, the treatments used, and the patient's overall health. Generally, patients are seen more frequently in the first few years post-treatment, often every few months. Over time, if no problems are detected, visits may be spaced out to once or twice a year. Lastly, remember that a strong support network is invaluable during the follow-up period. Reach out to friends, family, or support groups when you need to, and don't hesitate to discuss any concerns with your healthcare team. In conclusion, clinical surveillance and follow-up care for leukemia patients involve regular monitoring for early detection of recurrence, monitoring recovery, early detection of secondary cancers, assessing ongoing treatments, regular lab tests, monitoring for long-term side effects, patient education, addressing patient concerns, and providing a strong support network. Thank you for viewing this informational video brought to you by Fight Cancer Global. For additional content and support, you can visit our website at www.fightcancerglobal.org, where you will discover a great many resources as well as a supportive community that knows your cancer journey. Let us join forces and make a meaningful impact in the fight against cancer.